All right, okay, let's dive in. Imagine. Imagine a disease so bad people actually call it brainer. Today, we're digging deep into thromboembolic meningoencephalitis, TEME for short. It's this really complex neurological thing affecting cattle, especially, in feedlots. Our mission, to pull out the key facts from the sources you've shared with us, get you up to speed on what TEME is, how it works, and importantly, what's being done about it.
Yeah, and it's pretty fascinating how a bacterium that's usually quite common, how it can suddenly turn into something so incredibly damaging, systemically damaging. Understanding TEM, or sleeping sickness, as it's sometimes called, is, well, it's vital, crucial for anyone in animal health, agriculture, or even if you're just curious about the kind of challenges vets face. It's a big piece of the puzzle in livestock health.
Okay, so we've set the scene for this brainer disease. But to really get it, we need to know what causes it. How does this bug, this seemingly ordinary bug, become such a menace? Our sources point towards Histophilus somni. That's the culprit.
That's right, it's a gram-negative bacterium.
Okay, gram-negative,
Yeah, it just means it has a particular cell wall structure,
Huh.
and it's opportunistic.
meaning it doesn't always cause disease.
Exactly. It usually just hangs out, harmlessly in the respiratory tract, even the reproductive tract of healthy cattle. It needs an opportunity, a weakness, to cause trouble. We see it mostly in feedlot cattle, maybe 6 to 12 months old. But you can find it in grazing animals, too.
Right. But the really interesting bit is how it flips that switch, from harmless resident to, well, to deadly invader.
That really is the core of it. So H. somni gets into the bloodstream, usually via the lungs. Then it travels around the body, and here's the key thing. It sticks to the endothelial cells.
The lining of the blood vessels.
Precisely. And that attachment, it triggers this massive inflammation in the vessels, that's vasculitis, and crucially, it causes blood clots, thromi, to form, especially in the tiny vessels of the brain stem, the spinal cord.
Ah, so that's the thromboembolic part of the name, the clots.
Exactly. Thromboembolic meningoencephalitis, clots causing inflammation of the brain and its membranes. These clots, they're often kind of messy, full of immune cells. And this whole process, the vasculitis, the clotting, that's what really makes TEM so destructive. It cuts off blood supply. The brain tissue around these blockages then suffers from, well, bleeding, necrosis tissue death, and you get this flood of inflammatory cells rushing in.
Wow, so it's directly attacking the brain's vascular system. Is it only the brain?
No, not at all.
Well-
And that's important. It's systemic. Because the bacteria are in the bloodstream, they can set up shop almost anywhere. We see severe pneumonia, heart muscle inflammation, myocarditis, arthritis in multiple joints, mastitis. It really can spread throughout the body.
Okay, so it's a whole body problem triggered by this one bacterium.
Yes, but it's not just about the bug itself. Environmental stress is a huge factor here.
Like what kind of stress?
Think about young cattle. They get weaned, shipped long distances, maybe handled roughly, put into crowded feedlots.
Usual feedlot stressors.
Right. That combination puts immense stress on their systems. Or maybe they have a viral infection already weakening them. That stress seems to be the trigger that allows H. somni to really take hold and cause disease. Outbreaks are much more common in fall, winter, spring, the colder months.
And how does it spread initially?
Calves often pick it up from their mothers, who might be carriers. Then in the feedlot, it spreads between animals.
And what makes this particular bacterium so, I guess, effective at causing damage? Does it have specific weapons?
Oh, it does. It's quite clever, really. It can change its outer surface, sort of like changing clothes, to evade the immune system. That's called phase variation. It can also induce apoptosis-programmed cell death in host cells, and it can even survive inside the very immune cells meant to kill it.
Hiding inside the defenders.
Exactly. Plus, it's very good at grabbing iron from the host. Iron is essential for bacteria to grow. There's even evidence suggesting that cattle with lower iron levels before exposure might get sicker, particularly with the pneumonia form.
Okay, so we understand the who and the how. Let's talk about the what's. What does TEM actually look like in an animal? How would you spot it?
Yeah, the clinical picture. It can be really varied, which is part of the challenge, and it often comes on fast.
Fast-like.
Like sometimes, unfortunately, you just find an animal dead. No obvious prior signs.
Wow.
But more typically, you see the neurological signs. That's where the brainer nickname comes from. It's pretty descriptive. You might see a high fever initially, a 105, 107 Fahrenheit. But that can sometimes normalize later on.
Right.
Then there's depression, lethargy. This can get progressively worse, leading to obtundation, like they're really dull, unresponsive, or even coma, especially if they go down and can't get up.
And the specific brainer signs, the neurological stuff.
Yeah, that's where it gets really characteristic. Ataxia is common, that's incoordination. Might have a stiff gait, seem clumsy, especially in the hind legs. You can see strange postures. Opisthotonus is a classic one where they arch their head and neck right back.
Oh, what? Right. I've seen pictures of that.
Yeah. Eye problems, too. Nystagmus, flicking eyes. Strabismus, crossed eyes. Blindness. Sometimes pus in the eye, that's hypopyon, or little hemorrhages on the retina. Some might become hyperexcitable, have muscle tremors, walk in circles, press their heads against walls or fences. Proprioceptive deficits, basically, not knowing where their feet are. And even convulsions or seizures can happen.
That sounds like a very rapid decline.
It usually is. Once neurological signs appear, things tend to go downhill quickly. If an animal becomes recumbent, unable to stand, they often die within a few days. And remember, it's systemic. So you might also see poor appetite, maybe coughing or nasal discharge if the lungs are involved, or lameness and swollen joints from the polyarthritis.
Gosh, with all those neurological signs, it must be easy to mistake it for other things, right?
Absolutely. That's a huge diagnostic hurdle. Vets have to run through a whole list of differentials.
Like what?
Things like polioencephalomalacia, PEM, often nutrition-related, listeriosis, another bacterial brain infection, lead poisoning, salt poisoning can cause weird neurological signs, even viral infections like bovine herpes virus or, rabies always has to be on the list for neurological cases.
So differentiating is key. How do you actually confirm it's TEME? You mentioned it's a combination approach.
Right. Diagnosis relies on putting together the clinical picture, sudden neurological signs in young feedlot cattle, often after stress with lab results, and very often post-mortem findings.
And getting samples to the lab sounds critical.
Oh, incredibly critical. The bacterium H. somni is notoriously fragile once it's outside the animal, so you need the right tissue. Brainstem or pons is often best, and it has to be fresh, not put in formalin.
Good.
Keep it cool, on ice, get it to the diagnostic lab ASAP. If there's going to be a delay in culturing, it needs deep freezing, like below -60°C, to keep the bacteria viable.
And what tests do they run in the lab?
Well, culture is still important, trying to grow the bacteria from the tissues, but because it's fragile and can be tricky to identify biochemically, speed is essential. Nowadays, molecular tests like PCR are really valuable. They detect the bacteria's DNA or RNA. Faster, very specific. PCR looking for the 16S rRNA gene is considered probably the gold standard for identification.
Can you test the spinal fluid?
Yes, cerebrospinal fluid analysis can be helpful. In TEME cases, you'll typically see high protein levels and lots of neutrophils. Those are specific white blood cells indicating inflammation in the CNS. Sometimes it looks a bit yellowish, xanthochromia from previous bleeding.
What about blood tests for antibodies, serology?
Serology, it exists, but it's not that useful for diagnosing active TEME in an individual animal.
Why not?
Because H. somni is so common, many healthy cattle have antibodies from previous exposure or antibodies that cross-react. So a positive result doesn't necessarily mean the animal has active TEME right now.
Okay, so clinical signs, history, careful sampling, PCR, maybe CSF. Or what about necropsy? What do you see if an animal dies?
The post-mortem findings are often very telling, almost pathognomonic, meaning they strongly point to one specific disease. Grossly, meaning what you see with the naked eye, you look for these characteristic hemorrhagic infarcts. Little areas of bleeding and dead tissue, often brownish red, typically where the gray matter meets the white matter in the cerebrum and thalamus.
Infarcts, like mini strokes.
Kind of, yeah. Caused by those blood clots blocking vessels. The brain might also look generally wet, soft, maybe the ventricle. The fluid spaces are a bit enlarged with watery CSF. You might see petechiae or ecchymoses, small or larger bruises on the brain surface, or the meninges, the membranes covering it.
And under the microscope.
Microscopically, that's where you really confirm it. You see the necrotizing vasculitis, the inflamed, dying blood vessels, and the thrombi, the clots inside them. Around these vessels, there's hemorrhage, necrosis, and lots of inflammatory cells. Often, you can actually see clumps of the bacteria within the lesions. You'll also find similar signs. Fibrin clots, inflammation in the meninges, maybe the heart muscle, the joints, confirming that systemic spread. It all ties together.
Right. So you get the diagnosis confirmed.
Mm-hmm.
What then? Is there effective treatment? You mentioned speed being critical earlier.
Yeah, absolutely critical. Treatment is possible, but honestly, it's a real race against time, and the prognosis is often Well, let's say guarded to poor.
Guarded to poor, that doesn't sound great.
It isn't. This disease progresses so fast, and the damage can be severe very quickly. Early, aggressive treatment gives the best chance. High doses of antibiotics are the mainstay. Oxytetracycline is often considered the drug of choice.
How is it given?
Intravenously. Fours is really important because in sick animals, especially those in shock or with poor circulation, absorption from muscle injections can be unreliable. You need that drug hitting the bloodstream immediately,
Okay.
usually twice a day. For how long depends on the severity, maybe just 2 or 3 days if caught really early and mild, but potentially over a week for severe cases.
Are there other antibiotic options?
Yes, florfenicol is one, though not for dairy cattle producing milk for food. A single dose might be enough sometimes. Telanthromycin is another long-acting antibiotic where a single dose might suffice. Penicillin or ceftiofur could also be used, but you always need to consider potential antibiotic resistance in your area.
And is it just antibiotics, or is there more to it?
Oh, supportive care is crucial. Just giving antibiotics often isn't enough.
Like fluids?
Definitely fluids, especially if they're dehydrated or in shock. Also, non-steroidal anti-inflammatory drugs, NSAIDs like flunixin, miglumin, that helps with the inflammation, the fever, the pain, makes them feel better.
What about steroids for brain swelling?
That's controversial. Corticosteroids like dexamethasone might help reduce cerebral edema, the brain swelling, but they also suppress the immune system.
Which could be bad if you're fighting an infection.
Exactly. So their use is debatable, kind of depends on the specific case and vet's judgment. And then there's just good nursing care, keeping them comfortable, maybe physiotherapy if they're down but still have a chance.
But even with all that, the prognosis is still iffy.
Yeah. The sources say, a 50% recovery rate is considered good.
Mm.
That tells you how tough this disease is. Some factors suggest a worse outcome, like if an animal loses deep pain sensation. Many that do survive might have permanent neurological problems. And like I said, once they go down and can't get up, they usually don't make it.
That really underscores the need for prevention then, if treatment is so challenging.
Absolutely. Prevention is where the focus really needs to be.
So what can be done to prevent TEME outbreaks?
There are 2 main pillars: vaccination and management.
Okay, tell me about the vaccine.
There's a vaccine available made from killed Haemophilus somnis bacteria. That's the old name for Histophilus somni.
Right.
It typically requires 2 shots, usually given at least 3 weeks apart. And then annual booster shots are needed to maintain immunity.
When's the best time to give it?
Ideally, you vaccinate calves around weaning time, or when they first enter the feedlot before the high-stress period really hits. But here's a really critical point about the vaccine. It's generally not considered effective if you try to use it during an active outbreak. It takes time for immunity to build up after vaccination.
Ah, so it's truly preventative, not a treatment for a current problem.
Exactly. You need to have that protection established beforehand.
Makes sense. What about the other pillar? Management.
That boils down to reducing stress and good biosecurity. Anything you can do to minimize the stress associated with weaning, transport, handling, mixing cattle, overcrowding, that helps.
Easier said than done sometimes in a feedlot, I imagine.
It can be challenging, yes, but even small improvements can make a difference. Proper nutrition is also part of it, keeping their immune system strong. Good hygiene in the facility helps reduce overall disease pressure. Some sources mention keeping wildlife out, which is always good general biosecurity, though maybe less direct for H. somni specifically compared to some other diseases.
So it's a combination: vaccinate proactively and manage the environment to minimize stress.
That's the best approach. Creating an environment where Histophilus somni is less likely to get that opportunistic foothold and turn dangerous. It really shows how much animal husbandry behavior and environment play a role alongside the actual microbiology.
So wrapping this up, quite a deep dive into thromboembolic meningoencephalitis, this brainer disease. We've gone from understanding how this common bacterium, Histophilus somni, can become a major threat through its unique ability to cause vasculitis and thrombosis, to seeing the often dramatic, rapid neurological signs, the challenges in diagnosis, the critical need for early treatment, and sadly, the often poor prognosis.
It really is a complex and often devastating condition.
And the importance of prevention through vaccination and stress management really comes through loud and clear.
It certainly does. And perhaps the story of Brainer leaves us with a broader question to think about. What can this specific disease teach us about the really powerful, sometimes subtle impact of stress, environmental stress on triggering disease? Not just in cattle, but maybe across different biological systems, maybe even including us. It's this constant interplay, isn't it, between the host, the potential pathogen, and the environment they're in. Disrupt that balance, and things can go wrong very quickly. What really stands out to you after digging into TEME?